Isabel?
Hello. Thank you so much for having me, Senator Carlucci. I'm grateful here. My name is Isabel Ibrahimi, and I am a certified ADHD coach. I am grateful for the opportunity to be speaking on this crisis. The name of my practice is Help Is Here Coaching. It is my personal mission to help improve young people's lives and the quality of their lives, but also helping them to reach their potential and their purpose. I help both young and old people alike who are impacted by ADHD. For those of you who are not familiar with ADHD, it is now the term used instead of ADD. ADHD stands for Attention Deficit Hyperactivity Disorder. As an ADHD coach, I'm on the ground working with all kinds of people. Hence, I come before you today as someone who works with both parents of young children and teens, and I work with adults of all ages. I also provide professional development training in schools and organizations, such as camps, such as nonprofits. It is my personal mission to help improve the quality of life for anyone impacted by ADHD. I'm not a doctor. I'm not a diagnostician. However, I have a lot of life experience on this topic. I coach people of all ages who have been diagnosed with ADHD and help them achieve their goals and reach their potential by teaching skills, tools, and strategies on how to manage their ADHD. I help families and individuals and organizations of all kinds learn about ADHD and how to work with one who has it. I come before you with both professional experience, but more importantly, personal hands-on experience that drove me to become an ADHD coach so that I could prevent tragedies such as a young person taking their own life. And I am a mother of 2 with ADHD, and the older one is now nearing graduating college. I have 2 cousins who have died as a result of this spiral of suicide. 1 out of 11 has ADHD, regardless of socioeconomic, racial, ethnic, gender, and any other factors. ADHD does not reflect one's intelligence. In fact, Joel Nigg in Clinical Psychology Review wrote that the documented percentage that suicide is the 2nd leading cause of death in children ages 10 to 18 and young adults. Accidental injury is number 1. All of this is relevant because children with ADHD have a 3-fold risk of serious life-threatening accidental injury when depression, ADHD, and substance abuse are combined. Suicide risk can be increased 10-fold. Lastly, 1/4 of suicidal children under the age of 12 have ADHD. In a review, systematic review of 26 research studies published in World Journal of Psychiatry, when ADHD has a comorbid factor such as depression or anxiety, the risk is very real, as you have heard from presenters before me today. In fact, the more intelligent the individuals are, the more they suffer, and they are aware of what they cannot do, which is control their ADHD. They are aware of how they cannot control themselves. Their ability to attend is impacted. So, what does the ability to attend mean? It is about being able to focus. It's about being able to process. It's about being able to learn and take in what is going on around them. The brain scans show the lack of activity in the brain, and executive functioning is the ability to plan, organize, and coordinate. That's impacted by ADHD. Rarely is ADHD seen on its own. And there is what is known as a comorbid factor, which means that there is another challenge that is also at play. It could be a learning challenge, it could be anxiety, it could be depression. Often they go hand in hand with ADHD. And you've been hearing about all these other issues throughout the day. And as such, both have to be addressed. As I mentioned, I'm not a doctor, but I'm on the ground working with people who have ADHD and their struggles, and I coach them. I want to point out hope and determination and a sense of self and how they play a huge role in determining outcomes. As an ADHD coach, I provide professional development training to those working with youth, and I also teach young people and their families what helps and what worsens the symptoms. Impulse control is a huge issue with ADHD. What is impulse control, you may ask? It is the ability to stop ourselves from doing what we want now and blurting out what we think. Dr. Ned Hallowell says ADHD patients have the brain of a Ferrari and the brakes of a bicycle, which I think is brilliant. It's important to realize that years of admonishment over time lead to destroyed self-worth. Why? Because when a child is told all day long what they are doing wrong when they cannot help themselves and are told they are not trying hard enough or are lazy, this erodes their sense of self. I want to give you an example of a young child whom I observed be repeatedly admonished for his impulsive behavior. By the end of the day, this child's head was literally hanging low. And he had lost hope because he was not able to meet the expectations that were set before him. And he was made to feel he was doing it on purpose. He was only 5. Imagine this feeling of not measuring up, compounded over years. What I do is I educate parents and people who work with kids who cannot control their behavior. So when they are told they can and they are not trying hard enough, what happens? They give up. They become angry. Then what happens when they are teens and are exposed to drugs? Well, they try them, and that leads to self-medication. You've been hearing about self-medication all day. What is self-medication? Well, if an illegal drug causes them to feel equilibrium or stops the pain, they will continue to use it. If it means they can get into trouble doing so, it doesn't matter. And the lack of impulse control and difficulty attending makes them not consider the risks and the consequences. And then addiction and overdose and sometimes suicide follow. I am pained to tell you that my cousins died this way. Helping these children is a worthy investment on your part, and prevention is the key. I have a multi-level plan that is ready to hit the ground and create positive results. The children need to be identified, their families need to be, teachers and their caregivers must be made aware of what they have and how to help them. The parents and children in early childhood centers need to know that what they are experiencing has a name. So children will be given the help they need at a young age. These children need to be taught tools and actual skills and strategies. Simply talking about it doesn't help them. They need to be coached and shown what to do. It is important to note that prescription medication will not fix it on its own. ADHD medication helps, but they need tools and strategies. There's research that's recently come out, as I've been hearing presenters speak about this. It's important. There's a saliva test that it's called a cheek swab that actually will determine factors of medications that are suitable for an individual in their DNA. This is important because, as you've been hearing, toxicity of medications that do not work cause huge issues. It is important to note that 1 in 11 children and adults have ADHD, and girls present differently, but often go unidentified. Girls with ADHD have access to their prefrontal cortex, and therefore they can socially override, unlike boys. So girls do not get diagnosed, but are called shy or wallflowers or social butterflies or clowns. I know a mother whose daughter died at the age of 21. This mother spent years advocating for her daughter to have an IEP and services, and attended publicly funded special education schools, which cost New York State thousands upon thousands of dollars. Well, she is now dead, and so is her father, who had a full academic scholarship to college. Why? Because of self-medication and ultimately committing suicide. I have worked with a parent of an 11-year-old who tried to overdose on a bottle of Tylenol and Advil. I have a cousin whose father committed suicide through self-medicating, and whether it was an accident or not, the end result is that their life was wasted and they are no longer with us. Illegal drug addiction and alcoholism compounds these problems. What is important to know is that I have worked with teens that have begged their parents for help and were told to try harder, to get control. It is important for you to know that no matter how hard someone with ADHD tries, they cannot control their brain. ADHD impacts their behavior and their brain. I speak before you because I have met and worked with parents of young children who have been expelled by daycares and early childhood centers because they are too much to handle and their behavior is regarded as willful and intentional. Their parents have been shamed into thinking it is their doing, and then the parents had extended families have turned on their children believing that their child is bad. No child is bad. All children want to please their parents. It is critical to know that I am not talking about the parents who have the resources to pursue help and get support and tutors and counselors, etc., for their Ivy League-bound kids. Research shows that jails and prisons have an extremely high percentage of inmates with learning challenges, and what got them to break the law was lack of impulse control and the ability to attend. Society is paying a very high price, and in our public schools, a teacher is trained to teach but not to coach or be a social worker or a psychologist. When most of the teachers' time is going towards 2 children who have disruptive behavior, all the children in the class pay the price. I believe that New York State should be proactive in identifying and helping children with ADHD. It is a net loss to the state when funds are spent on incarceration, drug addiction, rehabilitation, mental health issues, unwanted pregnancies, police involvement, school systems, and these children are not being identified, and they and their families are not being helped early on. These children need diagnosis, direct teaching of skills and strategies. Their families must be trained on how to work with them, and their teachers taught how to help them. The tertiary list of areas impacted is extremely long, and every area of society is impacted. I had 200 guidance counselors attend one of my workshops and was told they need to be coached on how to work with these children. I have been contacted by early childhood centers that had children in their programs that they didn't know how to deal with. With these children, they just didn't want them because they didn't know how to help them. So who pays the price in this situation? The child who spends 8 to 10 hours a day in that child care center 5 days a week for 52 weeks a year, and the other children in the group. It is devastating to hear a parent say that their 3-year-old has been expelled, and to watch a family begin to believe that their child is bad, or to be told by daycare that they don't have the money to hire me or someone to train them on how to work with their children who they're challenged by. I collaborated with the Child Care Resources of Rockland on a grant to help bring my workshops to parents and staff of early childhood centers, but unfortunately we did not receive the grant. So it is painful to know that these children and families are not receiving the help that they need. I'm here before you to demonstrate the desperate need of these children with ADHD, 1 in 11. A condition that impacts the child's life 24 hours a day, every day of their life, and which causes a great deal of emotional pain. That pain is preventable if parents are coached and children are taught tools, strategies, self-awareness, self-advocacy skills to help them navigate the chaotic nature of their condition. And they can become productive, fulfilled members of their communities instead of another suicide statistic. I want to point out that when recognized and helped, they can be extremely successful. Look at Michael Phelps. He is a perfect example. Teens that end up dead or incarcerated due to not having received help and fall into the trap of a life not fulfilled due to the lack of impulse control is a tragedy. I was asked to run a support group for families, but asked to find the funding to do so. Educating families is essential. I ask you for the financial support to implement the programs which will change outcomes. I ask you to consider how many millions of dollars the state will save by recognizing this correlation and the desperate needs in our communities. Because it is clear that I am not talking about the kids who already have the parents with the resources and the kids who are getting the help they need, like IEPs and 504 plans. I'm talking about all the thousands of children who are not being identified and not being helped, but rather labeled as lazy, stupid, troublemakers who are just bad, or the girls who are not being identified or reaching their potential. The net economic loss and drain on society is preventable. And in the end, an investment in these people will save New York State a lot of money. Investing in coaching of these children, specifically 1 out of 11 children, will give them the opportunity to become active, productive members of society and prevent thousands of suicides. The ADHD coaching I am proposing will produce active skills and strategic both for the individuals and their families, and because ADHD is known to have a significant genetic component, and hence you will be preventing the multi-generational reality of suicide. As in the case of both fathers and later their young children from committing suicide. In closing, I want to thank you for this opportunity to speak before you, but most importantly, thank you for recognizing that we are facing a crisis and prevention is the key. As they say, 1 ounce of prevention is worth a pound of cure. In this case, it cannot ring more true. You have the ability to bring about change in this tragic statistic and to reverse the course of these statistics. And it is irrelevant whether the suicide was intentional or not, because they are actions of someone who is trying to alleviate their mental anguish and pain. And you have seen how ADHD drains society's resources. And while we are here speaking of the full economic impact of not diagnosing and addressing ADHD, investment in identification and support and ADHD coaching will help, in fact, save the New York State millions of tertiary expenses it has occurred and will continue to occur. So I beseech you to implement these changes. Thank you. I agree with the following individuals who spoke to you about Kathleen Carney on accidental overdoses, impulse control and inattentiveness. Accidental overdoses or suicide attempts are connected because they're not thinking about the consequences. So I also agree with Matthew Shapiro from NAMI about thinking in terms of how to give them skills. Swab tests for drug compatibility is critical. I have had a child who refused to go to school for 3 months, whom I work with, and it turned out that this lab test actually helped this child recognize, the family recognize, and the doctors recognize that the medication was completely adversely affecting them. When Brett Scudder spoke about a 4-year-old and a 5-year-old, the 10-fold risk of suicide is very real. Ben Esposito talking about camp directors. I've heard adults speak about what it was like for them to be in camp and how painful it was. Teenagers who are camp counselors and young adults do not have the skills in order to be able to work with these children. Impulsive behavior can be exhausting, but when one is trained and educated, it is really life-changing. Dr. Jeffrey Daly's concern for 3 to 5-year-olds and not receiving any service, it is very painful to meet parents whose 3-year-old has been expelled from 2 places and may not be able to find another. Children are good. Thank you.
Thank you so much.